What is the difference between a submentoplasty, Z-plasty, and platysmaplasty? Would filler be enough to resolve sad mouth area? I am 66 and had a successful facelift 20 years ago. Now I have sad face and loose neck and confused about what is best procedure for me. I am convinced of natural fill using Aqua Lipo after seeing a picture of a woman on Real Self who still looks beautiful after 1 year. Do the doctors think that one of those procedures plus fat transfer will be sufficient to bring back a more youthful look? I can't afford to do yearly fillers, which are temporary fixes in my experience.
Thank you for your questions. You've asked two questions. One is the difference between a submentoplasty or Z-plasty versus a platysmaplasty, and the possibility of using some type of long-term filler to help with the downward turn of the corners of the mouth and to restore volume. And you also comment in your question about not being able to afford temporary fixes. So let's start with just understanding where you are at this stage of life. You've had a successful facelift 20 years prior, and you're now 66 years old. It's very important to understand that facial aging goes on and that there is continuous loss of bone, muscle, and fat. So regardless of what procedure you do, you can have procedures that have long-term benefit, can last a while, but at this stage of your life, just think about it, the difference between going from 26 to 36 versus 56 to 66. It's a very different facial experience. So with that being said, let's first answer the questions that you have about submentoplasty or Z-plasty and platysmaplasty. First of all, what's the objective? The objective is to improve the under the chin area, the submentum. The mentum is the chin, and so submentum is under the chin. All of these procedures describe ways to try to improve the neck angle without doing anything beyond that. A typical neck lift involves the incision behind the ear and some partially in front of the ear and lifting the skin as well as the platysma and tightening it to get an improvement in the angle. Now let's say you want to just do this area and you want to try to improve that. It's possible. It may not be as effective as a neck lift, but when you talk about a Z-plasty, well, what you're describing is a removal of skin. And the point of the Z is to change the vectors of tension so that you don't get a straight scar that can widen. This area of skin, this skin can be challenging, and I have done this type of procedure and I've gotten fantastic results, and I've done the same procedure and I've gotten thickened scars. So there's a risk involved with that procedure. I've been able to help those patients. I used a method of helping scars using platelet-rich plasma, extracellular matrix, and I was able to revise that scar and make that scar look good. But it can be stressful to have an undesirable thickening of the scar. The other procedure, a platysmaplasty, is actually working on a muscle called the platysma muscle, and it's indicated particularly when there's something called platysmal bands. That means those two neck bands that tend to be right in the center, and what we do is through a small opening go inside and tighten the muscle of the platysma and do some other work to try to get this neck angle to improve. I think that to make the recommendation that's right for you, you need a physical examination. I think it's very difficult, from the photo it looks like you have a little bit of extra skin. But in the absence of a physical examination and seeing you talk and move, it's hard to make a recommendation. But at least you understand what the distinction is between those two procedures. A submentoplasty can also involve work done without the Z-plasty, but actually going inside underneath the chin and working under the muscular layer and working under what's called submental fat. and doing some work with the different types of muscles called the digastric muscles. So there could be a lot of different procedures that fall under this umbrella of submentoplasty. Now, as far as the filler is concerned, you described something called Aqua Lipo, which is basically a different way to take fat out, but it's still essentially fat grafting. So what you're doing is you're taking fat from one place and putting it in another place and hoping that the volume of fat will hold. And any doctor who does this can tell you that between 30 to 70% of the fat can get absorbed. And so what I always tell my patients who are considering fat transfer is that you'll need at least 2 procedures. Just assume that and don't just expect, because technically I can place as much fat as I need to, but that fat has to survive. And we do all kinds of things, such as the use of platelet-rich plasma and other modalities to try to maximize the survival. But when you separate tissue from a blood supply and put it somewhere else, there is going to be variability in the take. Now, the thing that I also want to counsel you on is about this affordability issue. When you can't afford to spend a certain amount to maintain your appearance, it can certainly be very frustrating. Aesthetics is an area where you can spend a lot of money. And what I tell my patients is, whatever stage of life you're in, you kind of have to decide that this is a new normal for you and that you have to allocate a certain amount of budget. So a certain amount of money goes towards, let's say, a gym membership, but a certain amount goes towards food, gas, etc. And then a certain amount goes towards aesthetic procedures. You might be better served with spending a little bit less on a regular basis to get the benefits that you desire, rather than spending on surgery, which has the implication that it will last longer. Yes, the facelift really worked very well for you, and it's giving you more than 20 years of benefit. And that's not unusual. Facelifts can benefit anywhere from 10 to 20 years, but it is very variable. There are people where it can only last 5 years. It just depends a lot on the individual. But when it comes to fat grafting, you're talking about something very different. And so I think you have to learn more about this and really be honest with yourself on how much you can afford, and meet with doctors who will be honest with you about the outcome and whether or not you'll be satisfied. I always tell my patients who come for consultations, I'd rather not do a procedure for you than do a procedure where you're paying less, getting less of an actual procedure, and not being happy with the results. And it's all about communication and being able to set expectations. So with that being said, I hope that was helpful. I wish you the best of luck. Thank you for your question.